A nurse is caring for a client who was just admitted from the emergency department. Nurse's notes, 0945. Client is experiencing a sickle cell crisis. Client states that they began experiencing pain in the lower extremities 3 days ago and is now experiencing pain in the chest, rating it as a 4 on a scale of 0 to 10. Oxygen at 3 liters per minute via nasal cannula in place. Oral mucosa pink. No cyanosis. Pulse is palpable in all 4 extremities, no peripheral edema noted. Respirations even and slightly labored, lung sounds with slight wheezing on left upper lobe. Abdomen soft and non-tender, bowel sounds active in all 4 quadrants. 0.45% sodium chloride IV at 200 milliliters per hour, infusing to left hand with no reports of pain or swelling at the site. 1200. Client is sitting up in high Fowler's position and appears anxious. Client reports shortness of breath and severe chest pain as a 9 on a scale of 0 to 10. Client states that they have started coughing and are expectorating pink-tinged mucus. Lung sounds with increased wheezing in left lung and clear on the right side. Equal chest expansion noted. Neck veins flat. No peripheral edema observed. Vital signs, 0945, blood pressure 132/88, respiratory rate 22 per minute, temperature 38 degrees Celsius, which is 100 degrees Fahrenheit, heart rate 98 per minute, SaO2 95% on 3 liters per minute via nasal cannula, 1200, blood pressure 136/90, respiratory rate 32 per minute, temperature 38.7 degrees Celsius, which is 101.6 degrees Fahrenheit. Heart rate 110 per minute. SaO2 90% on 3 liters per minute via nasal cannula. The client is most likely experiencing blank and blank. Word choices: pneumonia, pneumothorax, fluid volume overload, acute chest syndrome, right-sided heart failure. The correct answer is, the client is most likely experiencing acute chest syndrome and pneumonia. Fluid volume overload is incorrect. While the client is experiencing an increased respiratory rate and shortness of breath, fluid volume overload typically includes moist crackles on auscultation, pitting edema in dependent areas, neck vein distension, and hypertension. Right-sided heart failure is incorrect. While the clients who have sickle cell disease are at risk for developing heart failure, the client does not have manifestations of right-sided heart failure. Right-sided heart failure typically presents with signs of fluid volume overload, which includes jugular vein distension, dependent edema, and blood pressure alterations. Acute chest syndrome is correct. The client is most likely experiencing acute chest syndrome, which can be caused by respiratory infections and debris from sickled cells. The client is displaying manifestations of acute chest syndrome, which include cough, shortness of breath, wheezing, tachypnea, fever, and chest pain. Pneumonia is correct. The client is most likely experiencing pneumonia, as evidenced by the manifestations of cough, shortness of breath, fever, tachypnea, blood-tinged sputum, and chest pain. Pneumothorax is incorrect. While the client is experiencing increased respiratory distress, a pneumothorax typically presents with reduced or absent breath sounds and unequal chest expansion.